Welcome back here, 8:22 right now. Sticks, sprays, gels, lotions, SPF, UVA, UVB. Your head might be spinning at this point. There are so many sunscreen choices out there. So how do you really decide what's right for you and your family? And once you do, are you putting it on correctly? You know, with a false sense of protection, you're really at greater risk for sunburn and skin cancer. So Dr. Lauren McCaffrey is a dermatologist with Kaiser Permanente, Washington, here this morning with what you should know for the summer. Thank you so much for being with us.
Thanks for having me.
So talk a little bit, I feel like sometimes we're beating a dead horse in the summer here, but we really need to talk about sunscreen and why it's important to wear that sunscreen.
Well, there are so many reasons why it's important to wear sunscreen. The main thing people think about is preventing sunburn, which is huge. But wearing sunscreen can also do so many other things. It can prevent aging from the sun, like wrinkling and sunspots. It can decrease your risk for skin cancer, precancerous spots, skin cancers like squamous cell carcinoma, or even the deadliest form, melanoma.
I know that when you go to the store, I guess it's good that you have so many choices, but you go and you see, the squeezy bottle and the stick and the spray, and there's 5,000 different brands. What kind of things should you be looking for when you're choosing the best sunscreen for your family?
The most important things to look for are the SPF. So that's the sun protection factor, and that's a big number that's usually listed on the bottle. So you want to look for at least SPF 30 on your sunscreen bottle. You also want to make sure that it says either UVA/UVB protection or broad spectrum protection, because the SPF number really only applies to UVB protection, and you need both.
Now, I want to ask you about the sprays versus the lotions and the gels. I feel like I'll use a lotion on my face and my neck, but then the spray is just so convenient. Is that just as good as the lotion?
Well, the SPF indicates the protection, of course.
Okay.
My main concern about sprays is that a lot of people, they take their spray bottle and they do this kind of thing. And when you do that, then you don't know. It blows away, exactly. You don't know how much is going on your skin or how much is going on the mirror behind you. So when I have people use sprays, I tell them to use it very close to their skin. It still needs a little bit of rubbing in, but it's so liquidy that it's good for body parts. You know, men who have more body hair, it's a little bit more elegant in that way.
Yeah, that's a really great point, to do it a little bit closer. So once you have it on, how often do you need to apply?
At least every 2 hours. So there's no such thing as an all-day sunscreen. And you also need to reapply after swimming or sweating. So likewise, there's no such thing as a truly waterproof sunscreen. You can find sunscreens that are water resistant for up to 40 or 80 minutes in the water, but still should be reapplied after swimming. And definitely don't forget, every 2 hours, you can't stay out all day at the pool or at the beach without reapplying.
It's such an important thing to remember. My husband grew up in Florida, and every year he goes to the dermatologist just to have kind of a once-over, you know, to make sure that they're looking for new moles or anything like that. What do people need to be checking for on their own skin?
So the main thing to check for are spots that seem to be new or changing. So that's really important. A new or changing mole should always be checked. So a brown spot that's growing, changing seems new, especially if you're in your 30s. Getting a new true mole after that age is unusual. But you also want to look for spots that can be signs of other types of skin cancer. So like a basal cell carcinoma, for example, sometimes shows up as a spot that people mistake for a pimple, but then it never goes away, or a spot that doesn't heal or bleeds easily after just washing your face would be abnormal. Those kinds of things should be checked.
Okay, so you really do have to keep an eye on your own self.
Exactly. Yep, exactly. About once per month, you should get in the full-length mirror and look yourself over head to toe as best you can, and keep an eye out for those kinds of things.
This is great information. Thank you so much. Really appreciate it.
Thanks for having me.
Yeah, it's great to have you here.